How did we arrive at the deadliest health crisis in American history? The primary villain in this horrifying story was Purdue Pharma, a pharmaceutical company. Purdue created the opioid drug called Oxycontin in 1996, and then they trained a sales force to intentionally mislead doctors. Purdue's goal was to manipulate doctors into prescribing Oxycontin to as many Americans as possible. But why would physicians actually go along with this? Some doctors were secretly paid high sums of money to keep prescribing this addictive drug. This, of course, is illegal. So Purdue pretended that they were paying these doctors to take part in speaking engagements that never actually took place. Other doctors prescribed excessive amounts of Oxycontin because it caused their patients to become dependent on the drug, meaning if they tried to stop, they would experience horrible withdrawal symptoms. This essentially guaranteed that their patients would need to keep coming back for visits in order to get their Oxycontin refilled. It's important to note, however, that not all doctors who prescribed Oxycontin had bad intentions. Many physicians were genuinely trying to help their patients and did not fully realize just how highly addictive the drug truly was. Purdue's marketing department realized that if they could get doctors to prescribe Oxycontin not just for cancer-related pain, but also for everyday aches and pains like arthritis or headaches, the company's profits would skyrocket. In order to convince well-meaning doctors to go along with this, Purdue created a massive, fraudulent campaign in which they downplayed Oxycontin's addiction risk. The company sent thousands of marketers into doctors' private offices to tell them that Oxycontin was far less addictive than the other opioid drugs on the market. The truth is that one Oxycontin pill had an effect on the body that lasted double the time as most other opioid medications. Purdue's reps told doctors that this longer duration of action made the medication less addictive, and that they should feel comfortable prescribing it to virtually all of their patients who had pain. Despite there being no evidence to support this claim, most doctors just accepted it as truth. In 2001, Purdue spent nearly $200 million just on marketing and promoting their drug. Their sales pitch worked. In just a few years, doctors were writing 6 million prescriptions of Oxycontin per year. During that same time period, addiction rates skyrocketed, causing immense suffering and countless overdose deaths.